Imagine you are helping people who have been involved in a crisis event. What methods would you use to support the affected people? You could consider psychological first aid. This is a simple, efficient method of providing initial support to people in crisis situations. But what about children? Will this support work for them too? During a crisis situation, a child will react and think differently to an adult. This is because children have specific needs according to their ages and are more vulnerable to adverse effects because of their physical size and social and emotional attachments to their parents. This is why psychological first aid for children has been developed. Psychological first aid for children helps to reduce children's initial distress following a crisis situation, such as natural disasters and conflicts. It can also be used during or after a crisis affecting a small group of individuals, such as a fire at a school. Knowing the right tactics to help children can be very empowering for people working with children, such as social workers, teachers, health workers, and people working for humanitarian organisations. Psychological first aid helps address short and long-term psychological problems in children who have experienced distressing or traumatic incidents. Children who have been through distressing events may experience common reactions such as sleep disorders, feelings of anxiety and depression, social withdrawal from others, concentration difficulties, crying, clinging behaviour and regression. Most children recover from distressing events without developing long-term mental health problems, and many children recover by themselves. However, recovery can be helped when children receive appropriate support at an early stage, and this can significantly reduce the risk of developing long-term mental health problems. Psychological first aid for children is an important factor for children's recovery from difficult experiences. Sign up to our e-learning course to learn the skills and competences you need to apply psychological first aid for children.